Start the recording. Well, thanks for coming, everyone. We really appreciate you taking the time today to join us for our second EdTech talk on solving the K-12 mental health crisis. We really hope to host these quarterly and talk about various topics related to EdTech and education, so stay tuned for more. If you're unfamiliar, the Iowa EdTech Collaborative is led by the Iowa City Area Development Group in collaboration with many partners from across the state of Iowa, several of which are on our panel today. We're on a mission to grow human-centered K-12 higher education and lifelong learning across the state. And we have many initiatives and events happening this year. So if you wanna stay in touch, we really encourage you to follow us on social media at EdTech Iowa and checking out our website, edtechiowa.com. First, some housekeeping items. We want this to be an engaging conversation and encourage you to ask questions throughout the session here today. We're reserving the last 20 minutes for audience Q&A, so we'll make sure to try and get to all of those questions during that time. No promises if we run out though. So thank you for asking good questions today. Without further ado, I'd like to introduce my colleague, Mark Butlin, who is the director of the Iowa EdTech Collaborative. He joined our team a couple months ago now and is off to a great start. Dr. Mark Butlin is the director of the Iowa EdTech Collaborative, promoting EdTech across the state of Iowa. Previously, he served as the Dean of the Iowa City Kirkwood Community College campus and was elected Faculty Senate President at Austin Community College. He's had several faculty and administrative duties throughout that time. Without further ado, kick it off, Mark.
Hey, thank you, Liz. I appreciate that. I'm so excited for this conversation today and to hear from our experienced panelists and what they're seeing on the front lines. You know, they say that 1 in 5 school-aged children have a diagnosable mental health issue. So the situation in our classrooms is certainly challenging. And yet, from what I'm understanding, we can predict that there'll be a sharp increase in demand for mental health services following stressful or catastrophic events like the pandemic. And so one of the things that we were thinking about as we were pulling together this panel is how are K-12 schools in Iowa positioned to meet today's issues, the 1 in 5 thing, let alone predicted future needs that may come as a result of this latency period after the pandemic. So we thought we'd investigate that. We want to take a look at the ways that education technology might be leveraged to maximize resources, particularly in rural school districts where maybe there aren't a lot of resources or resources are shared and spread thin. Are there ways that EdTech can meet the expected mental health demands that we see could be coming in the future? So that's the direction that we're headed. I'm going to begin by having each of our panelists introduce themselves, and then I'll kick off with questions. And before we quickly do those introductions, again, if you have questions, if you would just jot them into the chat section, Liz will be collecting those and helping make sure we get to those with answers. Dan, would you mind kicking us off with a self-introduction?
Sure. Good morning, everybody. I'm Dan Clay. I'm the Dean in the College of Education here at the University of Iowa. I'm a psychologist by training, been working in the area of mental health and school-age kids for over 30 years. And we recently, you may have seen, we recently received a $20 million commitment to start a new National Center for School Mental Health, focusing specifically on the needs of our K-12 schools and educators in Iowa. So it's great to be with you this morning.
Thank you, Dan. Sue?
Hello, I'm Sue Gehling. I'm a psychiatric nurse practitioner from Carroll here in Western Iowa. And I'm also the founder of Classroom Clinic, which is a school-based telehealth business that I started 2 years ago. So I've been in healthcare for over 30 years, and children's mental health is my passion. And living in a rural community has made me aware of all of the barriers and struggles that people in rural Iowa encounter, and particularly for trying to find access to children's mental health. And so I've really made it a bit of a mission of mine to help my patients, because I feel like the cavalry's not coming to rural Iowa. There's a lot of smart people in rural Iowa, and we need to work together to create some change at the local level to better meet the needs of people living here.
Thanks, Sue. Yeah, we'll take a deeper dive into that idea. Glenn.
Good morning, everyone. I am a clinical psychologist and director of research and co-founder of Cognito health simulation company that develops role-play simulations to teach pre-K-12 faculty and staff and students in active listening skills, gatekeeper skills, and so on. You'll hear more about that later. I'm also an associate professor at Baruch College, and if you haven't heard of Baruch, it's one of the senior colleges of the City University of New York. And lastly, the person who has a profound, warm set of feelings for Iowa, because I got my undergraduate degree from Parsons College in Fairfield, Iowa. I bet most of you have not heard of that college because it was closed a long time ago, but such fond memories of Fairfield and Iowa City and Ottumwa and so on. Nice to be here.
Thank you, Glenn. And finally, Kim.
Hi, everyone. I work with Glenn at Cognito. I head up our product strategy for our education programs. I come from a background in teaching as a former high school teacher, as well as a background in public health. So I'm very drawn to how we can use EdTech to really improve protective factors at scale. So excited to be here today.
Thank you. Okay, great. Welcome, panelists. And again, we appreciate your time. I want to begin by asking Dan a question. And he gave us such a quick overview of his background, but I want to mention two key things. First, he wrote an award-winning book called Helping School Children with Clinical Health Conditions, a Practical Guide. I love that. His recent research has focused on reintegrating children who have experienced chronic illness back into schools and communities. So Dan, as a researcher, as a writer, and certainly as an administrator there at the School of Education, brings some insight. Dan, I wonder if you could set the stage for us. How would you characterize the state of mental health in K-12, either nationally, or probably what we're most interested in is what you're seeing in Iowa post-pandemic? And I say post-pandemic, even though it's not really post-pandemic, we're sort of still in the throes of it.
Mid-pandemic, right?
Yes.
Yeah. Thanks, Mark. Iowa's not a lot different than the rest of the country in that mental health has been a real serious challenge in our schools for quite some time. I think one of the things the pandemic has done is it's added an additional layer of trauma and stress for a lot of our educators and students in our schools. But it's also really revealed how some students in our system have, it's revealed how they're more vulnerable to the kinds of stresses that we have in our schools, and the pandemic is one additional stress. We get into some of those details later, but we look at data now. You mentioned 1 in 5 students. We're getting data now to suggest that 30% or higher of all of the high school kids in Iowa are reporting clinical levels of depression and or anxiety. So just to put that a little bit in perspective, just one school in Iowa City has 1,400 students, one high school, and you think of a third of them as having really significant levels of depression or anxiety, enough to impair their daily life. The scope of the problem is enormous, not just nationally in the state of Iowa. I think it's enormous for each community and each school. It's also not just an issue for the kids in our schools, it's a big issue for our educators as well, our teachers, our school counselors, our administrators. We're getting frantic calls and emails now from schools where teachers have just walked away from their jobs. Principals and superintendents have chosen to retire or move to different positions because the cumulative impact of the stresses and the pandemic and some of the mental health issues have just led people away from the education profession at a time when we really, really need good teachers. So, you know, a lot of the teachers are fearful, as are the students, and unprepared, I think, to deal with the significant issues, mental health issues that our students have. And, you know, I think we'll hear today during the panel how the scope of the problem is such that we can't simply rely on school counselors and school psychologists to address the issue. It has to be a systemic, system-wide capacity building approach to help address this problem. A lot of our educators are feeling depleted and burned out. It's not uncommon to feel that way at the end of the school year, but they're feeling that way now, and we're just now starting the school year. And I think a lot of you probably know, just in the last couple of months, we've had 3 high-profile teacher suicides in the state of Iowa. And so the problem is quite significant. So I think overall, you know, mental health has been a really serious issue for a long time in our schools. The pandemic has really fueled the problem and made it more significant. And I think it's taken a lot of kids who maybe struggled with mild to moderate anxiety and depression and put them into a state where their stress is really significantly interfering with their ability to succeed in school and to progress.
Dan, thanks so much. How about a quick follow-up on that? As you think about the state of our K-12s in Iowa, what are we doing well? And then what areas of concern do you want to underscore?
Yeah, I think, you know, one of the things that I see now that's very helpful is we're talking about mental health. We're having this discussion today around technology, but it's focused on mental health. I think the mental health conversation now is at every dinner table in our country. Mental health has touched nearly everybody somehow in some important ways, and that's been, I think, exacerbated with some of the social isolation over the course of this pandemic. So I think one of the things we're doing well is we're talking about mental health. We're recognizing that it's a significant problem and it's deserving of our utmost attention. I think that new awareness of the scope and the severity of the issues in Iowa is resulted in some positive steps. I mentioned to you the University of Iowa's partnership with the Iowa State Department of Education to create this new Iowa Center for School Mental Health. That's a really big positive step. There are a lot of people in Iowa, some on the call here with us today, that have been working in this area for a very long time. You know, historically, Iowa's been very under-resourced. We have fewer inpatient mental health beds per capita than most states. And I think for a lot of people working in this area for a long time, it's been a real struggle. This recent recognition and the commitment of new resources to address this problem is one positive thing. Just early this week, we saw another round of $8.6 million mental health grants that were given out to schools in the state through the State Department of Education. So that's another positive thing. And I think that the ability for us to collectively work together as teachers, as psychologists and mental health providers, and as business owners and technology experts to come together in an interdisciplinary focused approach to solve this problem is a really positive thing. So I think those things are some positive things.
Thanks, Dan. Hey, I appreciate that. Liz has chatted me that I missed Amy when we were doing introductions. Amy Colley is with us. She's currently the Director of Intervention Program at United Action for Youth. Amy, do you mind if I give you a second and we back into that with your introduction of yourself? And then I have a question for you.
Sure, of course. So yeah, like Mark said, I'm recently, in the last 3 weeks, started a job at United Action for Youth, a local nonprofit, as the Director of Intervention Programs. Previous to that, I was a student and family advocate at City High School, and my focus at City High was working with doing some case management for students with mental health concerns. And so I was kind of on the ground day to day, calling mobile crisis, talking to families, getting students hooked up with therapists in the area, doing the hard work of working with our students with the mental health issues.
Thank you, Amy. And again, I apologize for
problem.
missing you in the intros. One of the strategies that I had when we were putting together this panel was Dan can sort of lay in broad strokes what we're seeing, but we really wanted someone who's a practitioner who is right there. And with your experience at City High, you were the natural fit. So we appreciate you being here. I wonder if you can give us some insight into your world as someone on the front lines. How resourced are you? What challenges are you seeing?
I would say I would completely agree with Dan that things have gotten a lot better. There's a lot of positive that's happening. When I started at City High 6 years ago, obviously pre-pandemic, I was already seeing dozens of students in my office daily that were struggling with a mental health issue in such a way that they couldn't do school. There were plenty of kids that were going through the school day and had a mental health issue, but there was a large chunk of the population that just, you can't learn when you're struggling with a mental health issue. So I was kind of the triage person in the building. There would be students lined up outside of my door, and I would try to do the triage work with the idea of getting them back to class, but then also trying to get them the skills to build and so that they could help themselves work through their mental health issues a little bit differently. I think post-pandemic, that just skyrocketed. The thing that's changed in the last 6 years is we're talking about it. So instead of a student coming into my office tearfully, nobody has known they've been struggling. Students are talking about it. And then because of that, I think we're starting to get people putting money where their mouth is. So we like to talk about mental health, but we're just recently seeing all of this money flood in so that we can actually put programs together to support. This isn't going away. And so instead of trying to put a Band-Aid on it and seeing a student that's struggling and saying, oh, get that student a therapist and they'll be all better, we know that it's a much bigger problem. We need a lot of wraparound services for our children. And that's what I see as the biggest change in the last 6 years, is just everybody jumping in. Teachers want to help. Some of them just don't have the skills. So training the teachers, training the support staff and the custodians and everybody to kind of be able to identify and then help pass along some of those skills to our students in school is what I've seen, which is really cool.
Yes, thank you. And so folks who have tuned in, we appreciate that you're here. Now that we've sort of laid a background and a context for the conversation with our first two panelists, I want to do a pivot now to the EdTech part of this. And there are a few companies for whom we have representatives on this panel today that are working in this space, and they're Iowa companies. And so let's make that move. And as we transition, I invite all the entrepreneurs who are listening in to be thinking about, are there other ways we can be making meaningful impact with startup ideas? So first, I wanted to introduce to everyone Sue Gailing. You heard her talk a little bit about her background, and I do want to underscore that she's a psychiatric nurse practitioner from Carroll, and she's familiar with the struggles in living in small rural communities. And that's what prompted her to be the founder of Classroom Clinic. You heard her mention that her passion is making sure that children have access to mental health care in rural Iowa. So, Sue, would you mind giving us sort of the 2-sentence elevator pitch on your company and what your product is and why it's so important?
Well, sure. Thank you for that introduction, Mark. So the top ranked concern of school principals today is the increase in disruptive behaviors and student mental health issues. So as an entrepreneur, I want to provide a solution to the pain points, that are out there. And the number one pain point of schools is dealing with disruptive behaviors and student mental health issues. So Classroom Clinic provides school districts with timely and convenient access to children's mental health care using telehealth and related technologies. So unlike other mental health agencies, we've developed and actually utilize a custom technology platform that allows our mental health providers to connect, communicate, and collaborate with school staff on behalf of students. And thus we're eliminating the silos that currently exist between the education and the healthcare system, because I think those silos are what are leading to lost opportunities, increased fragmentation, and there's not a lot of resources, but if we could better utilize the resources that we have, I think that we can improve some outcomes from there. So it's really more than a 2-sentence pitch there. And I apologize, Mark, but I wanted to give you just a little bit more of insight.
Thank you. Absolutely. And Sue, I'm so excited that I got to meet you at the EdTech Startup Weekend several weeks back. And I'm such a fan of all the hard work you've put into making this a successful run. And I'm rooting for you. And I know everyone else in Iowa is as well. As you're bringing this to scale, what challenges are you seeing?
Well, there's several. So I'll just mention a few for the sake of time. There has been some resistance in the past. I started this business actually pre-pandemic, and there's been some resistance to recognizing the role that schools have to play in addressing this issue. Because, and people may not realize this, but the highest public sector costs of children mental health illnesses are actually in schools. Usually within the special education branch, but the treatment of children's mental health is mostly a healthcare sector responsibility and cost. And so I think that's where we need to really kind of shift our thinking, and that's where those silos, are present. There's been resistance, and it's definitely improving since the pandemic. But even though the number one pain point of school administrators is dealing with mental health, there's still, in the past, has been a little bit of resistance in terms of, well, that isn't our responsibility, that's healthcare's responsibility. And I would argue that, as I mentioned, obviously the highest public sector costs of mental illness are actually within the education system. There's an 8 to 10 year delay between onset of symptoms and diagnosis. And the majority of those clinical symptoms are emerging while the kids are in school. So teachers are often the first to notice when students are having trouble, but those disruptive behaviors often go untreated or undiagnosed for years. And that's because we're looking through the lens of an educator. So I think a collaboration and trying to break down those silos and really working as partners is so critical right now. And I think EdTech, it's interesting, I get this as well sometimes. Well, what category of EdTech do you really fall into? And, I have to say, it's not there yet. There isn't a category for me, because some people want to say, well, are you a healthcare company? Are you an EdTech company? What is it? You're in this space. I've never heard of this space before. You're providing healthcare services in schools, and you're utilizing technology and integrating those services into non-traditional places. And you're using your HIPAA, FERPA compliant platform that you've created to actually have school staff be part of the care team. I mean, that's like different. It's very different. But in healthcare, we work within care teams all the time. We have different, professions, maybe the physical therapist, a pharmacist, occupational therapist. And so we have to start looking outside of that, healthcare space and look into the social space, because the social determinants of health, all of these things are affecting how well people are and how healthy they are. And we know that children need to be healthy to be able to learn. And so we need to look at non-healthcare people and bring them in as members of the care team. And so with this technology that we've created, we're able to do that virtually and make it efficient and make it as least disruptive as possible, but getting the services, when they needed in that location. Because in rural Iowa, again, I go back to rural Iowa because this is where we live. There's so many barriers for accessing services, and families often can't get off of work, and they have to travel for hours. But if we can bring the services to the school and collaborate with educators, I think it's a win-win-win, not only for education, for healthcare, but for the families as well. So there's been some resistance to change, and then that EdTech category that I mentioned before, I would say I tell people that I'm in the process of designing a whole new category, for EdTech. You have the curriculum products, you have the teacher needs, operational, needs. This is really a whole new kind of category that we're designing as we're living it. But it's a way to solve the number one pain point that schools are facing right now. So I think it's critical that EdTech is really involved in terms of thinking outside the box. Don't compartmentalize this into a curriculum product or something like that, but look broader and how can we use technology to help solve these problems? And
That's
so
such
I
an
think that's what we're
interesting
doing.
point. Yeah, absolutely. I think that's a great, in fact, we probably should bring in our next two panelists because they probably are resonating with what you're talking about in terms of recognizing that they have a product that addresses an important pain point, but it's revolutionary and new. So let's extend that thought. I want to introduce next Glenn and Kim with Cognito. And Glenn mentioned earlier that he's a clinical psychologist and was former chair of the Department of Psychology at Baruch College, CUNY. And he's co-founder and director of research at Cognito. And Kim serves as the product lead at Cognito for the education vertical. She's spent time as a senior client experience executive, and she has a diverse career in education, business, and nonprofit. So I thought it'd be great to hear from both of them. And I'll let the two of you tag team this. Tell us more about your company and the solutions that you're bringing that help us train educators, and possibly there's room for parent and peer training there as well.
If you don't mind, Kim, I'll do the 2-minute elevator speech and then hand it off to you. So Cognito is a health and behavioral health simulation company based out of New York City, where we create role-play simulations where users are placed in virtual environments and they interact with emotionally responsive virtual humans, could be virtual students as an example, that are coded with emotions and memory, and they'll react like a real student, for example, in psychological distress. And it's by practicing these conversations and getting feedback, ongoing feedback from a virtual coach, that teachers and staff and students become very good at active listening in terms of how to implement motivational interviewing skills, asking open-ended questions, making affirmations and emotional regulation, empathy, and so on. All those factors, those evidence-based factors that promote an environment where a student feels safe, comfortable, and they trust the interaction, where they'll open up and they'll reveal to you what's going on with them so you can direct them to the correct support services. And so my main job at Cognito is to examine the efficacy of these simulations, which I might say is excitingly effective because they've been listed in the National Registry of Evidence-Based Programs and Practices, and there's been perhaps a dozen journal articles published examining the efficacy in terms of how these simulations prepare K-12 educators and students. And with that, Kim, please take it away.
Yeah, I just want to echo some of the things that the other panelists have been saying. Dan and Amy and Sue talked about thinking about this more broadly and building capacity. We talk about the full community of support. For us, that means, teachers and staff. Amy mentioned everyone from bus drivers to others. It's important for us to make sure that they know that they have a role to play in this and they feel empowered to do it. So being able to practice conversations in a safe place with students who they may recognize as in distress or they may not, and a student comes to them as a trusted adult. Are they prepared to have that conversation, make that student feel supported, and pass off to the right resource for that student? That also means parents. So we are developing programs for parents as well, really so that parents know how to normalize these conversations and model these behaviors. That's really, students are learning so much from what they're seeing from their parents and others. And are we normalizing conversations at that level as well? And letting parents know that modeling help seeking, modeling talking about their emotions and their feelings. All of those things are very powerful as well. And giving parents a place to think about and practice those things. I know probably many of us are parents. We do this for a living, but even in our own conversations at home, are we thinking about those all the time? And so it's a really powerful thing. And then students. So that's an area of real focus for me as well. As a former high school teacher, there is not a lot out there, especially for your middle and high school students, to begin to think about, as Amy said, what are these skills and what skills can we help build? We know for a fact that many of these skills become protective factors. And it's not just some of the help-seeking skills and those types of things, but also things like goal setting and some of the coping skills that we know students have been thinking about this year. Can we build on that? Can we take the momentum of what students have been learning about coping skills and resilience and continue to build on those for lifelong skills? So we're really trying to work across all of those and use what we do distinctly, which is the ability to actually practice these conversations and these skills in our programs.
Thanks so much, Kim, and thank you also, Glenn. At Kirkwood, when we moved to all online, we were surprised that there were a number of students who were more excited and more likely to use some of our student services when they knew they could do it remotely via Zoom. We had a real uptick, and that spoke to me. I think sometimes we think that we're just making do with a technological sort of Band-Aid, and then we discover that, no, actually, this is an improvement. And I want to give the panel one brief example before I move to sort of a speed round of questions. And my example is, there was a company, I think they were out of Austin, an EdTech startup, that created an app that would be on a student's smartphone. And it would periodically throughout the day, maybe a couple of times each day, send a prompt. How are you feeling? What's going on? How are things going? And the students understood that it was a chat bot kind of thing happening in the background. So for them, it was almost a diary exercise. And what the researchers found as they beta tested this product was that students apparently were 5 times more likely to disclose to this app that they were under distress or that they needed help than they were to go to a teacher or to a counselor or some other resource face-to-face. And what that meant was the educators were able to do triage. They had a dashboard that let them see, of the 400 students maybe in their caseload, that these 3 are peaking, right? This is where my time needs to go. Powerfully useful. These kinds of revolutionary uses of technology can make a huge difference. So Liz has invited you, if you haven't yet, to post some questions for our panelists. We'll turn to those questions here in just a moment, but feel free to post those questions into the chat. And for the speed round, what I want to ask each of the panelists is, in one sentence, what areas do you see as the biggest needs for some bright, innovative EdTech startup to move into? And I guess let's just take this in the same order that we did our introduction. So we'll start with Dan.
Thanks, Mark. And thanks to all of you for your insightful comments. I see the two biggest issue is, one is an issue of access to the kind of support and help a person needs when they're in distress. And so partly it's the number of trained mental health providers that are available to serve our youth. Even in Iowa City, there's a 6-month to 1-year wait for an adolescent that wants individual counseling in the community. And we have the highest number of mental health providers per capita in the state. So imagine what it's like in the rural areas. So I think that's the single biggest thing, is somehow using technology to find ways to get to providers that can provide the service. And then second of all, and I think, Sue and Cognito work in this space too, is how do we raise the capacity for all of us as a community to help support people in distress? So in the schools, for example, it's not just the teachers, as Amy mentioned, our students talk to the janitors, to the secretaries, to the people working in the lunchroom. Oftentimes they're the frontline people that our students talk to or that recognize symptoms. And so how do we help them learn the skills they need to understand when there's really a serious issue that has to be attended to? And I think that the skill building that Cognito is working on for people in that larger education environment is a real important resource. I think those are the two big things for me.
Thank you. Thanks, Dan. Amy, would you like to chime in?
Yeah, and my answer would echo Dan's, and I'll put two little slants on it. In addition to access, I think we have a real language barrier problem. We have so many students that speak a different language and they just cannot find services. So somehow, and Google Translate's not going to work in a therapeutic setting, right? So just that cultural piece we need to address in a major way. And then I am so excited, Kim, when you talk about giving parents the skills. I think we know we need the entire school, but man, parents really need those skills as well. When I taught dialectic behavioral therapy at City High, I would teach these kids skills and they would say, oh, I wish my mom knew how to validate. I wish my mom knew how to ask open-ended questions. I wish my dad. And so I think we leave when we talk about mental health, especially in schools, we oftentimes leave parents out of the conversation, and they should be front and center. They should be the top of the conversation. So that's super exciting to me, Kim, what Cognito is doing for some parent training too.
Yeah, fantastic. Yeah, language and parents and peers and how we talk. So we're down to our last 3 minutes before we open it up to questions, and I want to honor that 20-minute question and answer session. But back to our lightning round. Sue, would you like to chime in on what maybe beyond your startup that you can see as room for innovation?
Interoperability, being able to interface with other systems, particularly the student information systems. And of course, what we do is we have parent consent before we're seeing any children. So having that ability to connect with the school systems with parent permission allows us then to be able to measure the impact of the mental health services on those academic metrics that the student has. And so I think that's a really big challenge moving forward is, having an interface and developing some traction with the student information systems here in the state.
Great. And finally, Glenn and Kim, can you chime in?
The CDC, before the pandemic occurred, has indicated that the #1 public health concern is childhood trauma and adverse childhood experiences. So I think it's incredibly important to reach out to parents who have children, young children, and teach them evidence-based ways, have them practice in evidence-based ways to correct their children's behavior to prevent ACEs from occurring. We know ACEs have a tremendous impact on children when they enter into early education, has a tremendous impact on chronic diseases later on in adulthood. We need to teach our parents parenting skills from ages, from birth up to, 18 years of age. And one last thing, that 50% of all ACEs occur in the first 5 years of life, 30% of them the first 2 years of life. That has to end.
And I'll come back to what Dan started with. We're losing teachers, and a lot of that needs to come down to not only training teachers, but getting the students the resources that they need. Teachers are not going to be counselors. We don't want them to have to be counselors. So how do we make sure that when they identify a student, they have somebody to refer that student to, and that student then is able to connect with somebody. And I saw in the chat, and I love that somebody brought this up, I really think there's a huge thing around peer-to-peer. We have started down that road with some of our curriculum. We know we've done a ton of focus groups with students. They are more likely to tell a friend something going on than ever to talk to an adult. So how do we make sure that in those conversations, we're normalizing support and making sure that they are seeking help for things that are outside their abilities to manage as students. So I think there's a huge opportunity there that we've started down that road, but there's so much more that can be done.
Perfect, thank you. And thank you all panelists. That takes us right on time to our Q&A session. And I've been previewing some of these questions, and I think I just want to start with the order that they came in. I think they're all really good ones. Let's see. First one that I see came from Kate Moreland, and she said, are we addressing mental health of educators as well, which is such an important point. She says it feels like challenge for so many right now, and perhaps this type of technology intervention can help educators as well. Thoughts about that, panel?
Well, I can go first. I completely agree that that's a big issue. And the way we think about this is sort of the metaphor we use is, you know, when you're on an airplane, you put your own oxygen mask on first so that you can help the people around you. And you know, if our teachers aren't in a good place with their work at school, they're less likely to stay, and we need really good teachers, but they're also less likely to see and be prepared to help their peers and their students. So one of the focus areas for professional development in our mental health center is working also with the teachers and school administrators to learn to identify in themselves when stress is beginning to interfere with their ability to work effectively, giving them skills to manage stress, giving them the knowledge and skills to identify in their peers when stress is problematic and what to do when that happens. And so I think the skill building on the teacher and school administrator side as well. You know, one of the issues we have is that we often have our principals and our school counselors and school psychologists as the people to implement an emergency plan when there's a crisis in a school. But so many times the crisis also impacts the people that are supposed to be implementing the emergency plan. And so, you know, we've put in place an emergency response team so that we can have a team of experts on the ground at any school in the state within 24 hours to provide the kind of support our teachers and administrators need, because they're traumatized too. We have, you know, student suicides in schools. Students of our teachers have mental health issues too, and so do our educators as well. So I think we really have to focus on that too, to provide the kind of support environment that best serves kids.
Thank you, Dan. Does anyone want to add to that?
Yeah, I'll just add very quickly that the data we collected show that by teaching teachers and staff how to identify students in psychological distress and how to approach them, they themselves report more likely to identify distress within themselves and seek support. So it's like training the trainer, if you will, learning how to help students and then to be able to apply that to yourself. It's a nice outcome.
Glenn, this is a question that came from Ann Brendis in the chat room, and maybe you know, have you run across any programs that are peer-led, that is student-to-student based programs for intervention, or maybe just for conversations?
Yeah, so there's programs for peer-to-peer at different levels. So we actually have a peer-to-peer program that we would call Tier 1. You know, it's rolled out to all students and is going to teach some of those same active listening and help seeking skills to normalize those conversations. We work with a lot of districts who actually have peer group leaders to really, as part of their MTSS plan, do another level. And so they will train peer leaders and they will run those peer groups. That's really district to district. But there are programs out there that are already developed on what it means to train peer leaders and run those types of programs as well. I just think there's so much more opportunity there that I'd love to see that continue to expand.
Thank you. In a moment, I'm going to ask the panelists if you would like to direct any questions to anyone else on the panel. But here's, I think, a pretty quick one for Sue to field for us. This came from Giselle Cazares. She said that you mentioned about an 8 to 10 year delay in diagnosing children during time at school. And she wanted to know if this is the case for all age ranges, or are there groups that are heavily impacted?
Well, thanks for the question. And this is, I think, well documented information that 50% of all lifetime cases of mental illness begin by age 14, and 75% of cases by age 24. And we know that there's an 8 to 10 year delay between onset of symptoms and intervention. So it's logical that if 50% of the cases are beginning by age 14 and we have an 8 to 10 year delay, that there are symptoms, starting in these younger kids, and these mental health conditions are emerging, but it's unrecognized, undiagnosed, things like that. So the schools actually see things happening much earlier than, primary care or the medical healthcare facility, or even the family recognizing maybe what's going on. But without that clinical background, because they're educators, that's often, we don't know what it is that we're viewing in front of us necessarily. And we wouldn't expect, educators to be able to know exactly what are these clinical signs. Are these clinical signs, or is this just a child with some unusual behaviors that just doesn't happen to be responding to the, behavioral strategies that we're trying? So that is, I think, information directly from like CDC, that 50% of all lifetime cases begin by age 14. And so knowing that we have the 8 to 10 year delay, obviously a lot of what we're seeing in the schools in terms of disruptive behaviors, or, attendance issues, or dropping out. I mean, 37% of the kids with the mental health condition by age 14 are going to drop out. And so they have the highest dropout rate. And 70% of the kids who are in juvenile justice systems have a mental health issue. So all of this is really originating in childhood, but it's often not diagnosed until adolescence, or even early adulthood, or in some people, even middle or later adulthood, if they just never were receiving, treatment. So is that the case for all groups? Obviously some groups are, the minority groups, kids with poverty, and there's a lot of child poverty in rural communities. And so they are affected, at a higher proportion than, perhaps other groups are. But yes, I think that's, actually those are the unfortunate real statistics of what's happening.
Thank you. Dan, I want to get to your question to the panel. But first, Liz sent me an aside. Was it Liz? I think it might have been. Yeah. She said that some say that technology itself causes harm to children and adults, right? Maybe the hours just in front of a blue screen, for example. And so I guess her question is, how do we balance that reality with the opportunity that technology presents? Dan, have you run across anything along these lines in your research?
Yeah, the technology is a two-edged sword. Honestly, it can be used as a primary source to cause trauma or to bully, and it's easy to do that now online. I think we've seen a lot of that. On the flip side, during the pandemic, the technology was the only way a lot of our kids stayed connected to their friends through, playing Xbox together or whatever. And, like everything, moderation is probably a better thing than too much time online. But I think there are some ways that if we use technology well, it can be a real positive thing. And then, like everything, there are ways that technology can be used that are harmful. I think, parent monitoring is probably one of the most important things, not just of the time your son or daughter spends, behind a screen or on their phone, but also, monitoring their social media accounts and keeping track of the kinds of communications and relationships our kids have in schools is really important.
I also think when it comes to technology, we have to always include the discussion of access. You know, the school district did a great job last year during the pandemic of handing out hotspots and getting kids Wi-Fi that didn't have access to Wi-Fi. And hotspots didn't work for a family of 5, right? That we're all trying to get online and do classes over Zoom at once. So when we talk about using technology, I think that always has to be a piece of the puzzle, because we'll just increase that disparity in mental health access for students.
Yeah, absolutely. And if they're not even getting in the door because of technology issues, then we end up with equity gaps on the back end when we're looking at students that are able to complete, or students that are able to move on to a middle class, comfortable lifestyle. I think you really hit an important point there, Amy. And I know all of us as educators carry that concern about equity gaps and about access to quality education and support programs. Let's see, Dan had a question for his fellow panelists. He's wondering that aside from your own companies represented here, what opportunity do you see for technology to add value to our mental health efforts? I invite any of the panelists to respond to that.
I can start. So one of the things that everyone has brought up is just having enough mental health professionals to meet the need. I do think that there's a lot happening, especially in higher ed. I think higher ed is really leading in trying to address that, because they, for over 5 years now, have had way more students needing counseling services than the universities have had. And so they've been dealing with these backlogs for a long time. So they are becoming very innovative around that. And some of the things that they are looking into, and there are other companies that are doing this, are what does an online moderated peer-to-peer platform look like, where students who can go in and talk to peers, it's all anonymous, but it's moderated so that people can step in. If somebody, says, I'm thinking about suicide, there's immediate response to that, which is a better way to have peer-to-peer conversations than, say, if they're just texting each other, because they might not know what to do if somebody says that, right? And then there's other options that universities are looking at. The student is able to access the counselor, and they say, we think that you might benefit from some cognitive behavioral therapy, which has been shown to lessen depression and anxiety. There are programs out there now where you can do that, all online, still, in many ways moderated. And I just think there's so many things that universities are doing that, if they're very successful, will begin to flow down into K-12 as well.
Kim, maybe on the heels of that, someone had just posted the question: if we're using public TV to share sort of the language of being there for a friend or for a peer, sort of like a Sesame Street sort of approach to make this simple, but to provide people with the vocabulary and the strategies that they need. Have you heard of anything like that?
There was a big campaign called Seize the Awkward that, if you guys have never seen it, is great. I encourage, and that was put out in all kind of different places. It wasn't Sesame Street per se, but was really well done. And there's another one that the Ad Council just put out, which is it's really aimed at parents around talking to your kids about mental health, but it puts it around the language of music lyrics, which is a really great way to get parents engaged. What begins to happen is, a lot of times, those of us who work in the field, we speak a very different language than what parents and the community speaks. And so I love talking about, people who are focused on communication, really running those types of campaigns, because things like Seize the Awkward are relating it to talking to your kid about music lyrics and those kinds of things. That relates to their language. We've done enough focus groups to know that many of the terms we use either don't resonate with parents or turn them off. So I think there's a huge opportunity there that Sesame Street has probably done the yeoman's work over the years of getting people talking about feelings. So hopefully more of that will come.
Hey, Mark, can I add just a little something?
Yes, please.
Okay, just a couple of comments from the question that Dan had posed about, how can technology add value? And I think, especially now, in this world post-pandemic, or because of the pandemic, everybody's much more open to virtual learning and telehealth evaluations, things like that. And I think we can use technology to redistribute some of the human resources from other parts of the country into our state, into our school districts. So using technology like telehealth to redistribute available providers who maybe are not employed or who are in an area where there's a surplus of providers, and redistribute those resources using telehealth and get them to connect with the patients here in Iowa. So I see that as a real opportunity for how technology can add value as well. And then another just comment, again, dovetailing on something that Dan mentioned earlier. I think he was answering one of the questions about dealing with the educators. And I just wanted to mention that, compassion fatigue is real. And in the healthcare field, we talk about that a lot, as healthcare providers. You get burnout. And compassion fatigue is something that we need to address. And I think it definitely carries over to educators as well. They're feeling that compassion fatigue right now, being on the front lines. And just because I think there's a whole level of, some political pieces that are adding into, this pandemic that, are kind of pulling people in different directions, and it's just adding that much more frustration and that much more effects on their ability to be well and healthy.
Glenn, I want to ask you Dan's question as well. Aside from the products that you're working on, is there room for technology to add value in mental health efforts?
Yeah, the thought I had about this is using EdTech to do a really great job in assessments, where we have a high degree of depression, as Dan pointed out. We have anxiety disorders that are being manifested. And if assessments can be done online with a virtual human, where the student or adult feels more comfortable opening up, they're less likely to feel judged, there's less what we refer to as social evaluative threat, and they'll be honest. So by doing some really robust assessments, you can catch a lot of these things earlier, because it was mentioned that half of the psychopathologies are manifest themselves before the age of what did you say, Sue? I think it was
14.
Like 14.
Mm-hmm.
Yeah, I mean, if we can very sensitively and cautiously and compassionately do assessments, so we can identify and refer early in an individual's life.
Excellent. And that's, I think, a great place for us to wrap things up. We are up against our time limit. I sure want to thank you and all of our panelists for the continued service that you've done for our communities, and for being here with us today and sharing your insights. For those of you who tuned in, thank you for supporting Iowa EdTech, and you can stay engaged with us at edtechiowa.com or our LinkedIn, Facebook, or Twitter feeds, and Liz is going to include those in the chat box for your convenience. Liz also has recorded this for us, and she's going to upload that to YouTube, and she'll send a link to everyone who registered for this talk, so you'll get that. And she tells me that in that link, she's also going to include some information about about the Iowa EdTech Collaborative's participation in an upcoming Iowa Ideas Conference sponsored by the Gazette. So open the email to get the link to share with friends who you want to have the benefit of the insights from this conversation, and also open the link to find out how to join us on October 15th for the Iowa Ideas Conference. Again, thank you all for joining us, and I hope everyone has a wonderful rest of the day and terrific weekend and in mental health. Thanks so much.
Mm-hmm.